Hey, Zingers, and welcome into All Access. I've got a fantastic guest for you today. It's Paul Goode, the president and CEO of Glucotrack. That NASDAQ ticker is GCTK. He's joining us for an exclusive talk today. All Access starts right now. And it is my pleasure to welcome in the president and CEO of Glucotrack, Paul Goode. Wonderful to be with you today, Paul.
Good to be with you too, Dan. Thank you.
Hey, the pleasure and honor is all mine. Let's start off here. Give everyone an overview of Glucotrack, if you could.
Yeah. So we at Glucotrack, we tend to think of ourselves as medical technology innovators. We're trying to increase or improve the lives of patients with diabetes by developing really people-centric solutions to make their management of their disease less burdensome. So our flagship product is what we call the CBGM, or the Continuous Blood Glucose Monitoring System. And it's a very unique system. It provides benefits that are above and beyond what current CGM systems do. In particular, we're targeting to be the very first and only multi-year CGM system that has no wearable component for the body, and it measures the glucose directly from the blood as opposed to from under the skin in the interstitial space. So you're getting blood glucose real time, which is the gold standard.
Oh, that's phenomenal stuff. And, let's talk about the CBGM. Why is your CBGM technology competitive? Help us understand what makes it different from the traditional CGM's, quote, unobtrusive integration, end quote, works.
Yeah, so the traditional CGMs, you've probably seen these. They're devices that are typically worn on the back of the arm. They're very nice. They are small. They've done a lot of good to help people with managing their disease. Unfortunately, even though there's 10 million lives in the U.S. that are covered by insurance that can be using CGM technology, little over half of them are using it. So that leaves almost half the market segment that is not using the technology when they could be. And when you want to understand what the reason is, it really boils down to two things: wearability and accuracy. There's a collection of reasons on the wearability front. The adhesive itches the skin. Oh, it hurts going in. Oh, I don't want people to see me wearing this. Or it snags on the furniture. All those types of wearability issues are in aggregate one type of a problem. The other type of a problem is accuracy. Now, these sensors are indeed very accurate, the typical CGMs, but they do have a time lag from blood glucose, which is about 10 to 15 minutes. And that time lag is typically not a problem. However, when you have rapid rates of change, such as when you're exercising or when you're eating, or even, believe it or not, when patients with diabetes are stressed or when they're sick, their blood sugars can go up and down rather quickly. And that's when that 10 to 15 minutes is very important. So we believe we address both these issues, both the wearability and the accuracy, by having a fully implantable system with no on-body wearable measuring directly in the blood.
That's absolutely fascinating stuff. And, this is. Oh, go ahead.
I'm sorry. Go ahead.
Yeah, I was going to say, this is exciting too, Paul. You recently completed your first human clinical study. Can you walk us through those key findings and what this means for your development timeline?
Yeah. So we're excited. We just finished that first human study. Now, the first human study, when you think about our technology, effectively, we've got to prove 5 things, right? We got to prove that the device is safe to place in the patient, prove that it's safe while it's in the patient, that it functions while it's in the patient. Fourthly, that it lasts for as long as, we're talking 3 years here. And fifthly, that it's safe to remove or replace. And so what we did was a small acute study where we could address 4 of those 5 things. The fifth one, of course, is the longevity. That'll be proven in a subsequent study. But we did a small study in Sao Paulo, Brazil, at Incor Hospital, which is one of the, actually the leading cardiology and cardiovascular surgery hospital in all of Latin America. And you may wonder, why are you going into a cardiology or cardiovascular surgery hospital? The reason is that our device leverages a lot of the technologies from cardiology devices, such as implantable Holter monitors or implantable pacemakers. So the same types of techniques used to build those and to implant those are the same techniques that we use. So an interventional cardiologist is the perfect physician to do the implants. And the implant takes about 20 minutes. It's an outpatient procedure, very small skin incision, about 1/2 inch, and local anesthesia only. So we did this small study down in Sao Paulo, and we found that we met our primary endpoint. Our primary endpoint was safety. We wanted to confirm that there was no device or procedure-related serious adverse events. We did that. Procedure was safe, but we also wanted to look at device functionality and actually the surgical technique. Did we need some special tools or not? We didn't need any special tools or anything different that was typically used for these types of devices, or no special procedures. So we confirmed that, and we also had very good sensor function, and we had very accurate readings, and we're going to be presenting the actual data on those at an upcoming diabetes conference in Amsterdam next week at ATTD conference. So we're ready for the next step, which is the long-term clinical study.
And I know you got a new member of the team as well, Paul. Tell us about the appointment of Dr. Guillermo Umpierrez to your medical. How does his expertise influence your technology development?
Yeah, we're super excited to have Dr. Umpierrez, from Emory University in Atlanta to be leading our medical advisory board and help us build it out. He's our first member, and he's got such extensive clinical research experience. He's been an investigator on so many major CGM studies in the past for some of the commercial players that are out there. He's published over 500 scientific manuscripts and book chapters. He's also had a ton of awards from so many national organizations like the American Diabetes Association, the American Association of Clinical Endocrinologists, the Endocrine Society, the American College of Physicians, and the Diabetes Technology Society. And what's great about Dr. Umpierrez is, he's really a patient advocate, and he understands our technology can bring value to patients. Not everybody will want an implant, but many do because they're frustrated with, some of these issues that I mentioned before about wearability and accuracy. And so he will help us understand, how to apply our technology, for patients, looking for better tools for their diabetes care. So we're really thrilled to be learning from him and collaborating with him.
Yeah, it's always great to have those top level people, Paul, as you well know. And, when it comes to what I know you guys are going to be doing, I know Glucotrack's going to initiate a $3 million public offering. What do you plan on using that capital for?
Yeah, so we did close that, and we're using, of course, the bulk of that capital towards the study that I mentioned a little while ago, which is our long-term study. So as I mentioned with the first in human, we felt comfortable that we proved 4 of the 5 things, the 5th one being longevity. So we need to do a long-term study. So now we're going to have a fully implantable system. We're going to be kicking that off in later Q2. And it'll be done in Melbourne, Australia. There'll be 2 centers, up to 30 patients. And we're going to run the study for a minimum of a year. That's what patients are signing up for. And if things are still going good after a year, which we expect, we will file to extend the trial for another year and then yet another year, because we expect the device to function for 3 years. So that'll be kicking off again later Q2. And we're excited for those results to be rolling in soon.
To look forward for a minute here, how do you see the diabetes monitoring market evolving, and what role will Glucotrack play in reshaping? Here's Paul.
Yeah, so the CGM market has really evolved and progressed to the point that it is standard of care. About 2017, there was a major inflection point, I would say, in a couple of major inflection points in the technology as well as in reimbursement, which really catapulted it into, again, becoming standard of care and being used by so many patients, even though it's just a little over half. But if you go back and you look at market research from patients back then, and you look at what the market research says now, it's relatively the same things that they're asking for. They want the sensor to last longer. They want more discreteness. They want it to be or wear better. They want it to be a more accurate. And those complaints from, say, the 2017-18 timeframe are still there today. And again, there seems to be somewhat of a saturation, if you will, in the patient population. So we think that while the device manufacturers have actually made those improvements that the patients were asking for, and kudos to them for doing so, the patient voices are still there and they're louder. And so patients are still pushing for more improvements. And they're also pushing for maybe different technologies like what we're trying to do, which is something that is altogether new and completely redefined and new approach to glucose sensing. So we think we can bring that to the patients with diabetes, as well as a lot of these patients are suffering with a lot of comorbidities and, from other multiple chronic conditions that you can think of, high blood pressure, cardiovascular issues, and so forth, kidney issues, and sleep apnea. So we believe there's ways to potentially integrate our technology with some of those other technologies to treat those. So you could have a sort of one-stop shop to actually treat, maybe more than one condition with a single device. So at the end, we're really trying to change the shape of the future of CGM for patients, to bring more innovation and less, or more innovation, more convenience, to the point where, patients don't have to worry about, constantly ordering and managing their supplies like they do now. They don't have to worry about, having to replace the sensor every 10 to 15 days like they do now, or maybe it fell off, prematurely, or it's not working properly. It's really a set it and forget it, one-time implant for 3 years, no on-body wearable, and it just communicates directly to the smartphone. So that's what we're hoping to provide. We're really excited to help these patients and bring this vision to them.
Love it. Very exciting times for Glucotrack. Indeed, it was an absolute pleasure talking with you today, Paul. Thank you so much for your time.
Thank you, Dan. Really appreciate it, and take care. Have a good week.